Good afternoon, everyone, and welcome. I'm Debbie Wiegand, and on behalf of the Greenhouse Project, we want to thank you for spending some time with us today. It's my pleasure to moderate our webinar today and dive into a subject that's gaining quite a bit of interest. As you join us, please feel free to say hello and introduce yourself in the chat box. So our session today is titled How Senior Housing Design Can Reduce Transmission of COVID, the Impact of Critical Design Elements. And I wanted to begin our session by first saying and acknowledging a thank you to our sponsor. RDG Planning and Design is a multifaceted group of architects, designers, planners, and problem solvers. The RDG Senior Living Studio's primary focus is enhancing the elder experience, the impact of social engagement, healthy living, and a quality of life for elders and their caregiving teams. For more than 4 decades, the thought-provoking, collaborative approach of the RDG Senior Living team has combined their unique perspectives in development, operations, design, and business. And they've been instrumental in the success of their clients' mission-driven projects. So thank you, RDG. I'm going to ask Susan, Scott, Rob, and Martin to join me now on camera. Our distinguished panel today consists of 3 gentlemen that bring passion for and a tremendous amount of experience in senior living, not to mention experience with the greenhouse model design. In addition, our senior director, Susan Ryan, has joined us, and she's going to be gathering your questions today during the webinar, and then be back at the conclusion of our session for a brief Q&A. So be sure you're putting your questions into the Q&A box during the session as they come up. I'd like to briefly now introduce our panelists. Scott Pfeiffer is joining us, and he is a principal with RDG and Design. He has a focus on the senior living market, and he's been involved in design of environments for nearly 30 years. Much of his practice is dedicated to the design of senior living communities, from small PACE centers to large life plan communities. Hey, Scott. Martin Seifering is a principal with Perkins Eastman and the senior living practice side, and co-chair of the American Institute of Architects Design for Aging Advisory Group, and he has more than 29 years experience designing senior living spaces. Hey, Martin. And Rob Simonetti. Rob is a project architect and design director at SWBR Architects with 20 years of professional experience. And Rob has been focused on skilled nursing environments for the last 15 years and is dedicated to designing meaningful environments for elders. So thank you, gentlemen, again for joining us today. I want to share with our audience just a quick note that this session is being recorded, and a link is going to be emailed to you afterwards. So we again ask that you put your questions in the Q&A box. And again, Susan is going to collect those questions, and we will leave time for our panelists to be able to respond. So let's begin. When COVID hit in early 2020, skilled nursing providers found that their world was disrupted. There is some anecdotal evidence that smaller designs may be better equipped to deal with this pandemic than larger environments. But why? Is it just anecdotal? Or is there evidence to support why smaller may be better? At this point, the Greenhouse Project does have some early preliminary data that seems to indicate that mitigation is at play. But it is just that. It is data at this point. And we speculate that many of the design features likely contribute to the mitigation of COVID. Cheryl Zimmerman from UNC, is currently involved in analyzing the ongoing data that's being collected to inform the findings by the end of 2020. And we do look forward to sharing that information with you when it's available. As we look at design features today, we're asking our architect panel to share insights and experience about how design can impact the mitigation of COVID. So we begin by looking at the autonomous structure of smaller environments, the decentralization of services. Much has been stated about greenhouse homes related to design and the evidence behind the model. These homes come in many styles to fit rural, suburban, and urban communities. The homes are freestanding and fully independent homes from one another. They have a separate entrance known as the front door, and no physical connections exist except for a shared elevator or a corridor lobby in a stacked type building. They are independent of shared services. They contain individual kitchens, laundry space, dens for gathering, and a separate office. The homes usually average between 6,800 and 7,500 square foot per home. The autonomous nature of this model is far different from traditional skilled nursing. So could this hold insight into risk mitigation for the future? I'd like to ask each of our panelists now to comment on the autonomous functioning of home in a COVID era that we find ourselves in. So as architects, how has the intentional design of this autonomous functioning between homes been leveraged from your viewpoint during COVID? What have you found to be misunderstood or undervalued about autonomous structure and decentralized spaces and services? And Scott, I'd like to ask if you might kick us off with your thoughts.
Okay, as I listen to what you described, the first thing that comes to mind is the sanctity of home and honoring home. We all have a home, we all live in a home, and so there's a lot of different ways that you can define it, but there's some things that are very common in all of them. All homes are individual, whether they're spread side by side on a site or they're stacked in a multi-story building. They are all separate spaces that have a front door, as you had mentioned, as well as maybe, a back door and maybe even a service door or a side door. But there are limited ways in and out of our homes. And so as I think about that question, I think about how the front door is a pretty powerful tool in that we are all using right now in the spread of any virus, because we get to decide who comes in and out of our front door. And one of the things that I've noticed in maybe a misunderstanding of the sanctity of home is that it's not always honored all the way through. And most of the times I see it in maybe household design maybe it's more of a renovation where you're trying to get a household concept in an existing building and you put a front door on your household and it's not really, it's home-like, but it's not home because all the staff have to travel through this household to get to another household or residents or whoever. In the greenhouse model, the thing I like about it is that that's honored, and no matter what the configuration, whether it's an apartment building or a home setting, there is no traveling through one home to get to anything else. So you get to decide who comes into your home, which is, I think, the very first step in decreasing risk for any kind of virus.
Thanks for that. Yeah, that's very different from what you normally see in traditional skilled nursing. Rob, I wonder what your thoughts are.
Yeah, thanks, Debbie. If we look at slide 7, to me, this just represents this really graphic image that tells a lot about the value of the small autonomous home. Slide 7, yeah, thank you. Where we can see that the smaller cohort of residents in each building, resident staff and visitors, really limits the chance of infection either entering the building or spreading. So, item slide 7 is the difference between the more traditional institutional model that we're working from and moving to that small house. Again, with that graphic there, on the left, seeing how with one project we were able to decentralize, take out the residents from one floor, which were 42 residents on one floor, and spread them into 4 different houses. It really makes me think that the small house model or the greenhouse model acts like a suburb, where the houses are autonomous and individual and have separation. And our old model is more like a denser, busier city, an urban environment. And we can reflect back to April and how COVID spread through our urban environments, in New York and Los Angeles. And no negative on the urban environment. We love our cities, but it's really difficult to control these infectious spreads there. Where in the autonomous home, again, visually, this graphic represents how easy it is to understand how it's being effective and why it's being effective.
Thanks, Rob. Yeah, I think when you look at the kitchens and the laundries and those kinds of spaces, you're not having outside people come in. You're able to really limit the number of staff that are in those homes. Martin, I wonder what your thoughts are. We have you on mute, I believe.
Sorry. I think for the first time, one of the things that's happening is that there's a convergence of what's good for the quality of life of residents and what improves better clinical performance. There's been questions, we've all faced regulators who would say that the small house or greenhouse models were a compromise from a clinical performance perspective. I think for the first time, we're seeing everybody fall in line and say that there's much to be gained. And I think one of the things that Scott talked about was this idea of safety and sanctity. And the houses really offer that, and it works in a normal time when residents feel more secure because people aren't walking through their house disrespectfully to get to something else. And it especially works in a pandemic where you can keep people out the way we all do at home.
Any other additional thoughts? I was having a conversation earlier today with some individuals who were talking about the need to make sure staff that are coming in and leaving have space available to perhaps change clothes and what that looks like, before you enter. One of the things that came up in this conversation is the smaller these environments are, the less likely you have that much traffic running through double loaded corridors. And so, having a dedicated staff doing the kind of testing that's hopefully available to most people has really been able to be much more effective in these smaller environments as opposed to some of the larger ones.
Yeah,
Debbie, I think we've been seeing that, we started out right away looking at the mechanical systems and the ventilation. And I think what we were finding is that a lot of those perform pretty well. The newer communities are performing pretty well. It's the older ones that don't have the proper airflow. And I'm really curious to see if there's going to be data at some point of where all the issues have been in long-term care, what the age of that community is versus, some of the newer ones. So we spent a lot of time telling people what was going on ventilation-wise, but it seems like everybody's starting to come to the conclusion that it's spread more by staff and the touch points, those potential touch points between the elders and others. And so finding a way to start to limit that, I think, is a good idea.
And I think one of the things that happens in the autonomous households is you get these relationships between caregivers and residents that you don't see in traditional nursing homes. And those relationships make staff, I'm guessing, feel more accountable to what they're doing. So they probably are more prone to take care of themselves when they're not in the community, and they pay more attention to the risks that they're taking when they're outside of the community than they would in a normal nursing home, where they have much less strong relationships with the residents.
Yeah, and likewise, piggybacking on Martin's comment, is the sense of ownership you have in the autonomous home with the dedicated staff. In a small house of 10 to 12, you can really get to know the residents and know the home. You can understand the ownership, and in this time of COVID, being able to clean and monitor in a way in a home that you're familiar with versus being in a larger facility where, and there might be an assumption that it's someone else's responsibility, even on a unit. Again, I think that deep knowing that we talk about with elders also sort of applies to the building and the rest of the environment.
Well, thank you for those comments. I think what you're beginning to touch on is the fact that there is a physical design that we feel is got a lot of implications related to mitigating the risk of COVID. And with that, it's complemented by the people who are working there, which one of our core values, along with Real Home, is an empowered staff, self-managed work team. So it's hard to talk about just one core value when they all really need to work together. So I'm going to transition us now to another question I want to ask you about. And just to give you some background, providers and even the general public have come to understand the importance of private rooms, private bathrooms, a dedicated staff to a small number of elders, which we just talked about. But let's transition to better understanding the value of outdoors and the impact of that type of well-being on our elders during this COVID era. I listened to a greenhouse podcast last night, Elevate Elder Care, and we'll tell everybody about that at the end. But I was struck by the passion and the emphasis that Dr. James Wright expressed related to what he said was unfettered access to the outdoors. The greenhouse model ensures that each home has a porch of some kind and easy access to outdoors. The challenge lies in whether outdoor space is really accessible, and are providers willing to engage in the risk that's associated with using that outdoor space. There was actually a study where residents were found to only be exposed to 10 minutes of outdoor light levels per day. And as a former administrator myself, it really dawned on me one day when we took elders out how much they commented on missing the outdoors. So I'd like to ask you, in this COVID era, why are easily accessible outdoor spaces for elders important? And what can an architect do to support this type of design feature? What have you found? And Rob, let's start with you this time.
Sure, thanks, Debbie. Well, as you mentioned, we've been recognizing for years the benefit of outdoor spaces and their impact on well-being, physical wellness, mental wellness, the restorative properties, and the ability of nature to impact healing, and simply access to natural daylight, which affects our circadian rhythms and helps us sleep better and regulate our sleep cycles. So certainly any senior housing which can offer access to the environment in a meaningful way will help promote that wellness. I'm virtually sitting in my backyard. Behind me is our yard. And I can say that my yard makes me a much healthier and happier person. I don't see that changing, so I think we really always need to be mindful of making sure that our elders have that opportunity. So the greenhouse model, I've been passionate about because this, primarily because one of the aspects is as you said, unfettered access to the outdoors, where each home, and particularly in the model where it's a single story building. You've got access to a front porch, you've got access to a screen rear porch typically, an enclosed courtyard, you've got shaded areas, patios, gardening areas, and areas even just for the yard. So I think as architects in any model we're working on, be it the small house model or a larger institutional model, we've got to be mindful of those meaningful connections to the outdoors. And by meaningful, I mean the ability for the elders to really engage on their terms and their own abilities. And if that's in the traditional environment, then hopefully with limited staff help to get them outside, whether they want to just sit on a porch and look out or actually be out and engaged. Slides 17 and 18 are some of the images of front porch that you see at many of the greenhouse homes. And the front porch is not just about the attractiveness of the home or the ability for the elders to go out and socialize with each other or relax. But now in the age of COVID, you can really see these front porches offering sort of this built-in innate ability to promote visitation, right? We've got regulations now in each state that are really restrictive regarding visitation, making it tough on all of our providers to allow access of the elders to visitors and vice versa. So here in the greenhouse model, where you've got this front porch and the elders literally inside the front door, inside that yellow door on the left, where that's the living room, and they can get out to the front porch, be it screened or not, and their loved one could literally be in the car, be 15 feet away, or in a lawn chair out on the lawn, and be outside the building and be socially distanced, in a way that really is just not possible at most traditional homes, where largely the rooms are on the second floor and up, with public spaces on the first floor. So again, some of the things that the greenhouse has been doing so well for 15 years are, really starting to see tremendous benefit now during COVID. And certainly the access to outdoors is a huge one.
Well, you pointed out some great things there, Rob. And, little did we ever know the real value of what a front porch or a back porch or a patio can really do. So, Martin, I wonder what your thoughts are.
Well, I think the outdoors is also a proxy for our attitude towards risk. And I think as Rob talked about there, he used the term on their own terms. I see a lot of communities who decide whether it's safe or not for a resident to go out when it's chilly or when it's raining or when it's warm, and assuming that they can't make those decisions on their own and that they can't experience those kinds of things. I for one, would be incredibly frustrated if I could never again feel the cold or heat, even though I might not love it. But to experience it is something that is part of the nature of being alive. And if we can't get people out so that they can experience those kinds of things, it's I think that's an enormous loss. I think, again, to Rob's photo of the front porch there's something about defensible space as well, and those sorts of things. Those porches have existed in our homes for a very long time for a reason, and it has to do with making us feel comfortable and giving us that zone that protects us from things that we don't know. And at this moment, one of those things we don't know is a pandemic, and so it gives us a little sense of heightened security in our homes.
Martin, I wonder if you could also comment on buildings that are stackable, because you guys have done some design work related to greenhouse. When it comes to stackable design, a lot of times people don't think about how do you get outdoors incorporated into a stackable design. You have any thoughts on that?
Well, we try to integrate porches into those spaces so that if you're on the 16th floor of a building, I still would love to go outside and feel the wind blow through my hair, if I had any hair, and to feel the sun or the shade, all of those things that we associate with being alive. We've also done buildings that have roof gardens, that allow you to experience those kinds of things as well. For urban dwellers, it's also just having a distant view is also sometimes that connection to nature. I lived in New York for a long time, and I remember having conversations with my father where I'm on the phone looking out my window, telling him what the weather is like. Talking about the weather is one of those universally connecting things. And if you're inside and you don't even know, you can't tell what the weather is like outside, you're missing one of those universally connecting elements that make conversation easy.
Absolutely. Now, Scott, I know you've done some work in a stackable design also, and you incorporated some porches and really beautiful outdoor surroundings. So what would you add to this conversation about outdoors?
In a stacked environment, and I'm referring to John Knox Village, there were some of the images you saw earlier that were John Knox Village. The transparency from inside to out was very important, just like Martin and Rob were saying. If sometimes you can't get out, so that's how you're going to experience it sometimes, is by looking out. Also, by having a lot of that transparency, you get a lot of light in. So at John Knox, if you look at that design, that was so important to them that there are multiple areas where light is coming in, and you have views to the outside. There's a balcony that you can go out on if you want to go out and feel the air, or you can go down to the first floor and go out as well. But they also added a sunroom just to get light into the main part of the home from another angle, which I thought really helped out the amount of light coming in. And then we took that into the resident rooms as well and have large expanses of light. The thing that I think is the coolest about listening to my other architects here talk about the more human side of this is that I think as designers, and we need to try to not do this a lot. I mean, we have to do it, but it's concentrated on just at the activities of daily living and all the things that are required by regulation that you do. I think a lot of times we get in a hurry and we don't think about the activities of the soul, of the wind blowing in your hair, your feet in the grass, bird watching or whatever it is outside that you enjoy doing. And you need to try to maintain that for as long as humanly possible. And even if it is at some point from your room looking out a window, obviously you want to get out. And first option, but there's different levels there of getting outside, I think.
Something that you brought up, Martin, was risk. And long-term care providers oftentimes get caught up in this vicious cycle of how much risk can we really afford or not. And elders have a voice around that risk also. As a designer, and I would say all of you are taking this into consideration, but I think I've had this conversation with you, Rob. When you think about design, and then you think about meaningful life, which oftentimes people are engaging outdoors, so there's that aspect of meaningful life. Then you have this empowered staff. You talk a little bit, Rob, about how you design when it relates to making sure the staff has that visual sight line to like the doors that people are exiting, or so that they can see outside. So those doors don't stay locked. They're opened and people are encouraged to use it.
Right. Yeah, it's an important piece, certainly just in the greenhouse model. The ethos was always to make sure that from the kitchen, perhaps, that the staff could see the full extent of the home. So when we're doing that, we make sure to be able to see the front door so we can see who's coming and going. So it's the location of the office maybe, or location of the kitchen. Relationship to the front door is important. Then we also pay particular attention to the location of the courtyard, the enclosed courtyard, and where that is. Any space that is not seen won't be used. So on the traditional institutional model, it used to be a sunroom at the end of the hall. Well, maybe it never got used because staff weren't comfortable with people being down there, and that was in the building. So let alone outside. So in the greenhouse model, we typically try to orient the kitchen such that the kitchen has a view to the courtyard or the dining room. But if it's the kitchen, we would do it like a home. My home has a big window over the sink looking out the yard, so we can keep track of the kids while they're back there. So if we can build in that natural ability for staff to be in the kitchen or be in the dining room serving, doing what they're doing, but have eyes on the courtyard, that's going to make them feel comfortable with an elder being out there on their own if they can. And then also with the ability of the model to pair, again, the single family homes or the single story homes in pairs or threes or fours and create a quad. So now if my elder is out in the courtyard, it might be staff from home 2, 3, or 4 that also have the ability to have eyes on the courtyard and make sure everyone's safe and comfortable, that people can be out there on their own.
Well, thank you for that. I think those are some great ideas. And, you know, what I appreciate about all three of you guys is that you know this model so well, and you understand how these aspects of what we call core values really interplay to mitigate risk, to mitigate, you know, the COVID infection. So it's not just one thing, which is what you do, design, but you're taking into consideration really many aspects. So let's move now to trends. I think that there's a lot of people who are interested, especially from your three great minds, to talk about where are we headed. This model really constitutes an innovative vision of what nursing home care can evolve to be. And when design works for the elders that are living in that space. So I have a number of questions that I'm just gonna ask you to respond however you choose, but is the smaller environment type concept gonna grow? What do you see evolving over time in design? How are design goals going to change for our senior living in the future? And how do you balance this need for infection control without over medicalizing the desire and the need of the comforts of a real home? So there's a lot packed into there, which gives you a lot of leeway in how you want to answer this. But Martin, why don't you give us your thoughts and start us off?
Well, one thing that I think we were going to see is that from COVID, an increased emphasis on autonomy for the houses. And by that, I mean autonomy from hospitals as well. So I think we've learned that sending people from a nursing home to a hospital, there's very little positive that's going to come out of that experience. So how do we keep people in crisis in the small houses, and how do we support them? And that may mean that we have to have more clinical capabilities in the house, which we need to do without compromising the aesthetics. We've had, and bigger buildings where you have many houses, it's easier to suggest that maybe we could add some clinical capacity, some clinical space at the base of the building. In the freestanding homes, we're beginning to hear people talk about sort of mobile clinical capability. So if there's something that can be brought to a home, and maybe that might change the way we design a home to allow access to it more readily, perhaps. So that in these sorts of moments, residents aren't required to leave the house for anything. You know, even for a medical emergency, they can be handled in the house. And with telemedicine, that becomes more and more possible. But I think that's definitely an area of change in the future.
Scott, what would you add?
I'd like to build on what Martin was saying a little bit. If you advance the slide to the next slide there, we've been seeing, this is unrelated to COVID, but we were seeing a trend in short-term rehab spaces for people to want medical gases. So the image you're seeing right now is more of a hospitality model. People are going there to get better and then go home. But what it ties in well with what Martin's saying, because we could do this in a home environment as well. And finding a way to provide those medical, institutional type things that are required, but not sacrifice the home. And in this picture, the picture of the tree on the wall behind the bed actually moves up and out of the way, and there's medical air, oxygen, and suction in that area. So it's present if you need it, and you move it out of the way and access it. But when it's not needed, it doesn't compromise the environment. And the thing I love about it is you don't see equipment like oxygen concentrators around and things like that. It could be used for more respiratory type rehab, pneumonia, COPD, RSV, and probably the issues that they're having with COVID too. I don't know that for sure, but that's one way that we could keep elders in their room and not have to have them go out into the community for medical reasons.
You've done a really nice job of being able to disguise that medicalization that generally, if you walked into a hospital room, that's what you would see. So that's a pretty cool idea. Yeah. Rob, what are your thoughts on this?
Yeah, I think, Debbie, for the future, I think it's interesting that right at the beginning, before we started the webinar, you said that, you've got a lot of attendees on this session, 300 plus, one of your highest sessions. And I think it's because we're seeing the effectiveness of the small house greenhouse model, and we need to learn from it. So our webinar attendance today, speaks to that. So I think that we're going to see our providers, looking at the lessons learned in the greenhouse model and the small house model and the effectiveness of it and how to bring it back to their campuses, be it by building greenhouse homes or by bringing the small house or the household model to their units, and creating more autonomous homes and creating better dedicated staffs and increasing the access to outdoors, things like that. We're working with a provider in upstate New York. It has 148 beds of skilled nursing and a traditional model. And so we've been studying the greenhouse model and how can we bring a few homes to the campus to the benefit of the rest of the institution. And we're looking at, can we bring 2 houses, 3 houses, 4 houses? And with each, we looked at, if we bring 3 houses of greenhouse homes, what can we do? What does that give us in the institutional model? And so we're landing at 4 homes. We're landing at, let's build 4 homes. And then that will give us the ability to convert all of our doubles to singles in the traditional model. We'll also go in and think about the households within that model. We'll be able to open up larger common spaces, which we're seeing as effective in COVID for socially distanced. We're going to have better living areas on the first floor, better access to the outdoors for both the residents and for visitors. So there's a lot that the greenhouse model can do to inform our traditional campuses, either by building a full campus of them, or even just a couple gives us the ability to bring great benefit to the rest of the campus.
Yeah, you guys have, as I introduced you, I mean, you've been doing this for 15, 20, 30 years almost. And many of you are around when really the small house model, greenhouse concept began. Yeah, I heard you say, Martin, telemedicine's is big now, and it's certainly helping long-term care. There's a lot of new technology out there. How's that impacting what you design? How does that impact the infrastructure that you need to think about when you're designing? And I'm just going to give this example. Touchless faucets. We all know what those are. And they're great. You go in the airport and you don't have to touch anything. What about our elders? What about our elders that are 95 years old and touchless faucets and this technology? How are you guys balancing the new technology that we think is great and effective with the user on the other end, whether that's staff or whether that's elders?
I think that's a really great question, Debbie. I remember the first time we used touchless faucets in a senior living environment, which is probably 15 years ago. One of the first comments we got back was from complaints from the residents about how they didn't understand how they worked, and they were alien to them because they hadn't really encountered them anywhere else. And I do think there's some challenges in going that way. And I think this is probably something that we don't need to make universal decisions for. Some colleagues and I took a vacation together to Amsterdam and went to see one of the great senior living communities near Amsterdam. And one of the things they use the design guide is the statement, "Don't shoot the bear until you see it," which is this idea that if you have a deep knowing of the residents that you serve, and you have a reasonable amount of resources, you could change things to serve them as they need it. So a faucet, if you put a faucet in a resident's room, if a resident's going to be there for a while, it wouldn't take too much to turn off or to swap out a faucet if they objected to to an automated faucet. If they just can't cope with it, if it disturbs them, there's no reason you shouldn't be able to do that. And I think we need to look for those sorts of solutions instead of the sweeping solutions where we put one thing in motion. If we have a deep knowing of the residents, we can predict who's going to accept that, and we can evaluate it and make those changes.
When you pose that question, the first thing I always say to myself is, what would you do at home? And would you have a touchless faucet at home? And I don't have one yet. So I think, most people would probably say just use the normal faucets, and it's their private bathroom. So I would think that they could sanitize it in between and not have to go to a touchless faucet right away. The touchless faucets to me seem more appropriate out into the more public places in the home. But the thing that we've been talking about here recently is every room that we do, we give them a TV and they've got the control. And could you incorporate a button to flip over to Zoom and have a Zoom meeting right on your TV? And you could do telemedicine right there in your room, at your bed, or your chair or table off to the side. And then you could also do things with family members as well. And as we started digging into that and looking in a way of doing it in a retro fashion in the communities that are already built, it costs some money, but it's not huge. So that's something that we're looking at right now to see if we can bring that at least and test it out somewhere.
It's a great idea.
Yeah.
I think we've seen that some communities who had made really great investments in infrastructure and IT infrastructure and had devices in each apartment or in each resident room had much more success at communicating with their residents than did others. And communication has been super key in this event.
Absolutely.
To Scott's point, we're designing homes. Hopefully we're not designing institutions. So how can we make all these safety features and technological features invisible, like universal design does, with the intent of making every house or every space accessible to everyone? Well, invisibly, how can we make infection control invisible? So it might be in mechanicals and just thinking about the flow of air. Well, that's all above the ceiling. That's all invisible. And then creating those touch points that Martin and Scott talked about, keeping them home-like, right? Because we're in a smaller environment. But let's not make any, in the next few years, any knee-jerk reactions to COVID and any sweeping regulations that are going to impact our environments for the next 40 or 50 years. Let's really be careful of that. We don't want to live with COVID environments for the next 50 years.
Very, very wise words. Thank you for that, Rob. That's that balance of, making sure that we aren't over-medicalizing our environments, even though this pandemic is touching everyone, and especially long-term care. So I think we could keep talking about future trends, but I also know we've got a lot of questions. So I'm going to ask Susan if she would come back on and join us. And I know we've got some questions that have been coming across. So Susan, what's out there for questions?
Oh, we've got some great questions, that's for sure. So I'm going to jump right in. We had several on HVAC systems. And Scott, you kind of made the comment that you were thinking it was more about staff contact as opposed to older homes. However, somebody has pushed back and said, well, in our neck of the woods, it was the older homes that had worst outbreaks, which prompted some questions. Is there statistical information on the spread of COVID, whether it was through ventilation or through caregivers or other touch points? And it sounds like they're trying to validate their investments in enhancing their HVAC systems, whether it be SNF or their independent living apartments. And second part of that is, and would you have recommendations on enhancing or upgrading HVAC systems?
Debbie, do you have that handout that we were talking about maybe sharing with people, or that we can share with people?
Yeah, I don't know that we can pull it up right now, but you know what, so let me just, before you answer that, just share with the group. When we send out the recording, there is a handout document that Scott and his team had worked on, and it's about HVAC ventilation. I'll let you describe it because it's pretty technical beyond me, but we'd be glad to send that out to the audience and share it with them.
In small house homes, every room is private, so everybody has individual controls. So typically, the mechanical system is private to that unit as well. Now, I know that there's some older environments where they try to share air between multiple units and damper things back and forth to control the cooling or heating. And that's not what we've seen in the past. We've seen dedicated mechanical systems. So there it is, dedicated mechanical systems for each room. So this is an example, what you're seeing is an example of that. Usually there's a supply air close to the exterior window. There's a return air back by the door. And then the other yellow box that says HVAC unit, really that can be anywhere. It could even be under the window, kind of like a hotel room. We don't see that very often anymore. Matter of fact, we haven't seen that in like the last 15 years probably. So we put this together as this is what a typical room could look like. And then there's ventilation requirements where the exhaust air out of the bathroom typically is 10 air changes per hour. So because of that setup we went back 15 years to tell all our skilled nursing clients, this is how your unit was designed. Hopefully it's still operating the way it's supposed to. But this is how it was designed, and this is kind of a generic version of how that room would operate from a mechanical perspective. So the first thing you do is, if there's any spores in the air or bacteria, I guess, in the air, it could get caught by the return air grill and go through the ventilation system. And what we're finding is that the filters can't filter it out; they're too small. So that really doesn't do a whole lot of good. It's the changing of the air and the 10 air changes per hour that's coming out of that bathroom and being placed with new air coming in that is really important. And that is a big difference from newer communities and older communities. And usually you can tell just by walking in. Everybody knows what a nursing home potentially could smell like. And usually those older homes don't have that air change that the newer codes from the last 20 years probably require. So off to the right there are the 4 approaches to limit the spread of any disease. And ventilation, we think, is important. Air filtration is important, but we don't think it's as effective. But you have to get the tightest filter that you can get to try to catch stuff. But really the odds of something floating to the air, getting into the return air, going down and getting caught in the unit seemed pretty low as we were looking at it. But we had a client who said, okay, we're really happy and we're feeling good about this. Usually the rooms are neutral or slightly negative, so nothing's going to come out of the room. Things will maybe go into the room a little bit from the corridor area, but what can we do to enhance the situation? And so we recommended UV lights. Usually UV lights are put on cooling coils to help mold not grow. Still a good idea. I mean, from a person's health of the inhabitants, it's a good idea to do, but we haven't done that all the time. So that's something that's relatively inexpensive. You can do after the fact, and it would have an impact of some kind. The other one is ionization, and both those kind of can go together and be relatively inexpensive, but the ionization tries to take some of those germ particles and get them to clump together so that by the time they hit the filter maybe could filter them out. So, you know, again, it's probably a low chance of happening, but that's one way you could improve it. And then the jury's still working on this, but it hasn't been changing for the last probably 2 months now, is that humidity seems to be playing an important role, and the target seems to be 40% relative humidity, and no one can seem to explain why it's 40%. So to be lower than that, or you know, probably the viruses have a greater chance of survival. If it's higher than that, my understanding is that it's still good. It's better to be above 40, but 40 seems to be the sweet spot. And when we've discussed this with a couple clients, they're like, okay, we're not putting humidifiers on. And that's been one complaint we've had in other communities. It's so dry because of those air changes, it's very dry in here. So I think there's a human comfort side that we could be addressing as well, but humidifiers they're tough. You know, if they go out of whack and no one's watching, you can have mold everywhere and they're difficult to maintain. And so no one we know has gone that far yet as trying to, well, and we do a lot of work in the southeast part of the country, and a lot of times the humidity is already at 40% or higher. So we're knocking it down. So this handout will be available for the group. And if anybody has questions, both the engineer's contact information on there as well as mine.
All right.
Great. Well, let's take another one. Here's a question about how to redesign and reuse space in larger already existing buildings. So obviously we want to do something to repurpose some of those buildings. So I know each of you have done some of that work. So I would like to start. Martin, why don't you, I know you've done a lot.
I'm happy to start. So, you know, a lot of the older legacy nursing homes are alphabet shaped, commonly a T shaped, and they're often, if things are good, the elevators and vertical circulation are in the middle of that T. And what we've been working on is trying to reduce the census in buildings, because there often is not enough space without doing that to create the sort of spaces we need, and then turn each leg into some form of a household. We can't always get it down to 10 or 12, but sometimes, you know, even a household of 16 or 18 is better than a nursing unit of 60. And then to try to get each of those legs or each of those houses to have the autonomous functions that that the greenhouse standards have, so that we have living, dining, kitchen. We have a door. The door is locked, and you must ring a doorbell to get in, and those basic ingredients. I mean, it's not the same aesthetically as if we were building from scratch, but we can accomplish a lot. And we have a couple of communities in New Jersey that we had done that kind of work on in advance, who have had their struggles with COVID, but have been able to leverage the small house model and do better than they thought they could, do better than their competitors, their neighbors. In those
What
ways.
about you, Rob? Do you want to add on to that?
Yeah, I think Martin has got it right. You know, what we're seeing is the ability to take some of the old staff spaces on units. It may be the nursing station. There's oftentimes a lot of enclosed rooms in those environments. And now with new codes where we can open up some of those spaces to the corridor, where we can take some staff space and turn it back over to the resident, you are able to start to create those more open environments that give you more space. carving out some space at the exterior wall to, to create a living area that has daylight and views is important. And I think with study, I think most providers of an institutional model could do a very good job of converting to some extent to the small house model and seeing many of the benefits. Of course, it's not just the physical model, it's the staffing too. So changing the staffing to follow suit or even first would be a great step.
Great. So I've got a couple that are really very oriented towards COVID. And here's the first part of the question. How did the average square foot per resident of greenhouse change through the years? And do you foresee an increase in square footage due to COVID? And then there were a couple other questions related to that second part, such as isolated visitation lounge to facilitate family visits, staff changing areas, increased storage for PPE.
Yeah, Susan, I'll jump in first.
Sure.
I don't see that the greenhouse numbers have changed much over the years. We've tried to stay to a pretty small square footage, and our homes have been relatively the same for the 12 years we've been working on it. And those numbers are less than the typical institutional model, which we always use 750 square foot per resident, and maybe in the greenhouse home it's 600, 650. And I think in the future, I wouldn't necessarily see the houses getting bigger, but I would see using things like the front porch could perhaps be an enclosed 3-season or 4 seasons front porch. So the image stays the same, but by providing access from the outside and from the inside, we can create that sort of ante-room. So visitors don't have to come into the house at all, but can visit out on that porch. And we've got, the old vestige of the garage that is near the staff areas. So that may, increase in size or be repurposed in some way for staff coming in and PPE and all. But again, I would maintain, let's not start adding square footage yet. Let's think how we can repurpose and how we can change the facilities that we have now to work properly post-COVID.
Right. Scott, Martin.
I'm happy to jump in here. I have friends who know what I do for a living and have asked me, what should we do differently, and isn't there a better solution? And what I've been telling them is the innovation and the work has been done. It just isn't broadly distributed enough. The greenhouses are the answer. There really isn't a lot of reason to change much significantly. I mean, there are probably little tweaks about storage and other things that we might do, but I don't see them getting significantly bigger or the need to make significant changes. I think there's a huge need to get them more broadly distributed. I mean, the fact that we have a very small percentage of people who are in need of nursing homes having the opportunity to choose, a greenhouse or small house is unfortunate.
So I'm going to segue right now to, there's so many great questions, but there were a couple on advocacy, and I'd like each one of you to kind of offer your thoughts around this. So how do you advocate to design in a way such as this that creates autonomy and infection control? And what will it take on a national level to create smaller facilities in the future? And one final thing kind of related to that, when you talked about connection to nature, you talked about how important it is to get outside. Well, what about indoor lighting that simulates sunlight and instead of getting people outdoors? And how do we work with clients as well as regulators and so forth to make sure that we really push to get them to think bigger and get outside?
Can I take the advocacy question? I mean,
Sure. Yes, I want to hear from each of you.
I think that's something that many of us are have in our heads about how do we make change. And for instance, I've been in touch with my congressmen and my senators here in Pennsylvania, and just saying, look, this is crazy. You represent an environment that has a lot of seniors living here. We need to see some action and some leadership on it. And I think we need to hold our elected officials accountable. I think what's happened in the press over the last several months, which is really a lot of blaming of the operators of nursing homes where the nursing homes have failed, is maybe appropriate in some situations, but in a lot of cases, the blame is totally, misemphasized, and it really needs to be focused back at us as a society, that we haven't done the things that we need to do. And the people who make those decisions are our elected officials. So register to vote and vote.
Here, here. What about you, Rob?
Yeah, I would say seeing is believing. So anytime that we can help educate regulators, educate planning board members, that's the start point. And so here, as Martin says, you know what, we've got a model that works. It's proven. So we don't have to go out and reinvent the wheel, but we need to educate. We need to get the word out. And how do we all bring that to bear now in particular, before regulations and things start changing, to let's make quarters 10 feet. Well, no, let's look at the lessons learned of the greenhouse and the models specifically.
And Scott, final word.
I think that if there's a silver lining to COVID, this may be one of the silver linings, is it's making more people aware of this model and the success of this model in this environment. I'd like to think I'm helping by doing a webinar like this and helping get that information out to other people. I like the idea of contacting my congressman. I haven't thought of that one yet. But I do this because it's the right thing to do. And most people, when they see it, they agree. So we just got to get more people aware and see it more.
Well said. Debbie, back to you.
Well, thank every one of you today for being a part of this. This has been the highlight of my day, my week, my month, maybe for this year, to be able to talk about where we find ourselves today. So thank you to our panelists. Thank you to our audience for being a part of this. And as I said, a recording of the session will be sent out along with that document that Scott was referencing. If you heard me mention something about a podcast, I just want to let you know that the Greenhouse Project does have a podcast out right now, and it's called Elevate Elder Care. So if you get a chance to listen in, we've got some pretty passionate conversations happening around Elevate for Elder Care. And also we have an upcoming COVID Echo series that will be happening. And Janet, do you have a slide on those two things that you wanted to share? Maybe, maybe not. Well, they will be part of what we send out to you in the slides. So again, thank you everyone. We hope that you have a wonderful day, rest of the week. Here's those two slides. You can find the podcast on Spotify, Stitcher, Apple Podcasts. Take a listen. And then we also have the upcoming webinar, which is the 12th of August at 3:00 p.m. and talks about best practices related to COVID. So we'll catch you again another time. Thank you, everyone. Have a great day.
Thank you.
Thank you.
Bye.